Everyone. So we are glad to be here today. From this week through Nepal Iron Society and Ireland Nepal Chamber of Commerce, we are going to start what we call a weekly live broadcast. So what we'll be doing in this weekly session is we'll invite different people, different dignitaries, and people who are mostly on people who are working on different projects in Nepal and people who are working on building the relations between Nepal and Ireland. So we'll try to focus on various topics. It won't be on one specific topic. We will talk about with different topics with our guests. So to start with our event, with this weekly broadcast, we have invited today the chairman of Nepal Leprosy Trust, Mr. Mike Winterburn, and a board member of Nepal Leprosy Trust, Dr. Ann D, to talk about what Nepal Leprosy does in Nepal, what sort of work it has been doing, and when it was established, and all different details of Nepal Leprosy Trust. So without much ado, I will pass this on to Mike Winterburn and to introduce about what Nepal Leprosy Trust is. So Mike.
Thanks, Deepesh. Thanks very much for the invitation to share about the work of Nepal Leprosy Trust. So what is Nepal Leprosy Trust, or we sometimes abbreviate that to NLT? So Nepal Leprosy Trust is a charity in Ireland. It also is a charity in the UK, but it began in Nepal as a Nepali NGO in the 1970s. So I just give you a little bit of background there. So obviously in the name we work with people affected by leprosy. And in the 1970s in Nepal, there had been quite a lot of leprosy work in Pokhara. There'd been a hospital established called Green Pastures Hospital. And they discovered there that there's a big social problem with leprosy, and they needed to help leprosy patients find a way to earn their own livings. And what happened in the 1970s was the Nepali government in Kathmandu reached out to the one particular nurse who was working in Pokhara called Eileen Lodge to come to the Kathmandu Valley, where in a small village called Kokana, there were quite a large number of families affected by leprosy living in quite poor conditions. And so Nepal Leprosy Trust began out of that time. And if Deepesh could move his left shoulder a little bit, you can see our logo. And it says NLT, Empowering for Life. No, the other way, Deepesh, sorry. Empowering for Life. No, sorry. So he's dropped out, don't worry. We see leprosy is a medical problem, but a social problem. And we like to work with those affected by leprosy to empower them for living a life that's well and wholesome. They can work and live in their communities and earn a living. So my own personal connection began in the 1990s, where I volunteered for about 4 years at the time where we began Laugard Hospital, and I helped begin the social rehabilitation work that began at that time. I'll hand over to Anne if she wants to introduce herself.
Hi, so I'm Andy. I'm a public health doctor. I work in the Midwest, but I also worked in Nepal in the 1990s for a couple of years in the hospital, which is run by NLT now, Leprosy Hospital in the southern part of Nepal. And it was called Laugard, in case I refer to it again and you don't know what I'm talking about. It's Laugard Leprosy Hospital and LLHSC and Services Centre, I think is what they call it now.
That's correct.
I just wanted to share my screen talking about, does leprosy still exist? There's plenty of leprosy still in the world, and it's kind of concentrated in a few pockets of the world. So there would be a lot of leprosy in Ethiopia and parts of Africa. But again, you know, a lot of work has been done in the last 20, 30 years to reach elimination. And elimination is considered where the incidence rate is less than 1 per 10,000 people. Overall, in Nepal, leprosy has been officially eliminated, and it was declared so in 2010. But at what they call a subnational level, it's still a problem in some areas. And I had a nice screen. Nepal. So overall, this is a map of Nepal, and you see these are all the different districts. And where it's yellow, the incidence rate is less than 1 per 10,000, but where it's red, the incidence rate is still higher than that. And so, can you see my cursor? So our hospital is down here somewhere, around here somewhere, isn't it, in Indonesia? And so these are the areas that we work in Nepal, and the incidence rate is still higher than you wouldn't consider it eliminated. And I can stop sharing now. And so there certainly is plenty of leprosy there. There's another problem with leprosy, is that it tends to cause long-term disability. So while you can treat the actual infection, and it's caused by a bacteria, while you can treat the infection with antibiotics, much the same way as you would treat TB with antibiotics, it's a long course, so between 6 months and 2 years of antibiotics, depending on the severity of the disease. But the disabilities tend to remain in a lot of cases because they get nerve damage. So while you can eliminate leprosy, you will still have a large group of people who have suffered from leprosy and have been left with disability, and who may well be subjected to stigma because of the visibility of the disability, and who also may not be able to make a living as they, you know, say if they had been farmers or whatever. So they need to find alternative ways to make a living and to be able to support their families. So there's quite a lot of work around leprosy, even after you've managed to eliminate it, which, as you can see in that southern part of Nepal, it's still a long way off being eliminated. I think that's all I want to say. That covers about 2, 3, and 4.
Thank you. So could you talk about, so what sort of projects that Nepal Leprosy Trust have done in the past, and what projects are you currently involved in?
Very good. Yeah, so as I said, NLT began in the Kathmandu Valley in the village called Kokana. And at that time, they set up some vocational training for leprosy affected men and women, and sometimes their children. And they also we also established a craft factory that's in Lalitpur already these days. So they make handicrafts, leather handicrafts, batiks, felt goods, that kind of stuff. And then, so that's obviously in the Kathmandu Valley. And then since the 1990s, Laugard Hospital was established down in what is now Province 2 near Janakpur. And so there's a 90-bed hospital there with inpatients and outpatients. And as Anne mentioned there, one of the problems with leprosy is you may get nerve damage, and then you have to learn again how to protect your hands and feet. Otherwise they get damaged and you get ulcers, and then we get the classic kind of symptoms that we can associate, or the public might associate with leprosy, which is deformity. And then, leprosy in Nepali is called Kustarog or Maharog, and it means the great disease. and from a traditional point of view, not in Asia, not that different from the West. If you had leprosy, it was seen as being a judgment on your life. Maybe you had done something bad in a previous life, and this was like a judgment from the gods. And so society tended to stigmatize people with leprosy. Now, that's just a kind of traditional viewpoint. This is before it was understood that it was caused by a bacteria. And so there's been a lot of change in society over what causes leprosy and how we should interact with people with leprosy. But there is a big social dimension to leprosy. And so what can happen is if a man or a woman or even a child is diagnosed by leprosy, their community, their family, their wife, their husband, their parents can sometimes reject them. Now, it's not always the case, but it does occur. So we work in the community as well, particularly in Province 2, at explaining to the general public what causes leprosy. There's a bacterial infection, and it's not a judgment necessarily from the god or the gods, and we shouldn't reject people. And so part of that is an education program that gets rolled out in our community programs. And then also alongside that, we have found that if a leprosy affected person takes their medical treatment, they may still have nerve damage, which persists for life. And so they need to look after their hands and feet so they don't get damaged and ulcerated. And just as you know yourself, if you're on your own with a problem, we can sometimes run out of enthusiasm. And so sometimes people affected by leprosy, if they're isolated, they get quite depressed and withdraw from society. And we found that if we group leprosy affected men, women, and children together into what we refer to as self-help groups, they meet on a regular basis and they look out for each other. And so if I'm in the group with Anne, I'll say to Anne when we meet each week or something, how's your hand this week, Anne? And Anne will say, well, I've been looking after it really well, and it's good. And there's a kind of a motivational factor there. So we've been able to establish over 150 self-help groups scattered around Province 2 that meet on a weekly, fortnightly basis and so on. And that's a very powerful tool in the community. And that has become a footstep to bringing, through the self-help groups, we can bring health education, income generation, starting small businesses, encouraging school participation with children, and so on. And it builds a very positive energy in the self-help group. So that's another project that we do. We're quite active from time to time in helping particularly local communities around Laogai get clean water and sanitation, and local schools getting some extra supports. As can happen, if a family has a girl, sometimes the girls, if a family is struggling to fund getting their children to school, sometimes girls are not supported going to school and they can fall out of school quite early. So we have a lot of schemes supporting girls stay in education, or boys if the families are very poor. So we have quite a wide variety of projects going on, mainly down at Laogai these days.
That's great. Thanks, Mike. It's wonderful to hear the wide spectrum of projects that Nepal Leprosy Trust is currently conducting. So obviously, for all this type of work, you need funding. So I was wondering, do you have any particular source of funding? So basically, who funds Nepal Leprosy Trust?
Yeah, I'll answer that from two perspectives. One, say, from the NLT Ireland perspective, and the other from an NLT in Nepal. And so NLT Ireland would have roughly, the funding streams come from half from the general public and half from institutional funds like Irish Aid. And some members of the public give a significant amount of money, and some just give small amounts of money. Sometimes schools can give money. It's just ordinary people. We quite often, particularly around Christmas, we have little craft sales made from our leprosy affected people in Nepal, and that raises a significant amount of money from time to time. In Nepal, say for example, Lalgod Hospital, which we didn't actually say at the beginning of this talk. So Lalgod Hospital is one of the busiest leprosy hospitals in the world, and people travel to it for leprosy care, which traditionally, internationally, has been free of charge to leprosy sufferers, mainly because leprosy is seen as being a disease of the poor man, and they wouldn't be able to afford the costs associated with medical care. So the model that we're developing in Lalgod Hospital is people come to Lalgod Hospital for leprosy care. They also come because of skin conditions, and they also come for general medical complaints. And so in Nepal, about 30 to 40% of the costs of Lalgod Hospital is raised through general patients paying a small fee to receive the costs for the medical care. So we're moving towards a more sustainable model for the medical care in Nepal. As international donors, as Anne was saying, this is kind of a complicated subject, but WHO is trying to move away, and large donors are trying to move away from or considering the leprosy problem solved. And so finding international donors for leprosy work is getting harder as years go by. So we are looking to make the hospital more sustainable as we go forwards.
Also, one of the main funders for the hospital work at the moment would be the American Leprosy Mission.
Yeah. We have internationally, we have about 4 or 5 large international partners, and the American Leprosy Mission will be the largest partner.
Okay, yeah, that's great. Yeah, so you mentioned about Irish Aid helping or being one of the major donors of Nepal Leprosy Trust. So how consistent it is? Like, it is kind of a one-off donation, or have they been donating to Nepal Leprosy Trust on annual basis?
Very good. We've had, through the Irish Aid Civil Society Fund, we've had about 3 or 4 3-year grants through them. The earliest grant was to help us set up the self-help group network, which I mentioned earlier on, and then after that, for the last three or 4 calls, we've been supported through a project that we call Village Alive. And I'd just like to explain the concept behind Village Alive, because it's quite unusual. So as I said, we've already established this quite large group or network of self-help groups that may have half a dozen, a dozen, two dozens leprosy affected men and women and children linked to it. And the journey in the self-help group addresses what we refer to as stigma. So if you're rejected by your local community, it can be very mild or it can be very strong. And part of the work of the self-help group is to overcome that stigma. And what we found with the self-help groups would be, is as the members of the self-help groups look after each other, their well-being increases. So we've actually had a study from the University of Limerick that can verify this, that's doing a longitudinal study, but also small micro-financing projects increasing people's income. And the wider community gets a little bit jealous of how the members of the self-help groups are doing, and they want to join in the self-help groups. So that by itself is showing that stigma is being reduced. And we had one particular self-help group that had been on this kind of personal journey of overcoming stigma from their local community, and also in tandem to that, reducing their own personal stigma. So sometimes leprosy patients want to hide away and they stigmatize themselves. Other times the stigma comes from their family members or the community. So there's these two sides of stigma. So we had one particularly successful self-help group that had gone through this journey of overcoming personal and community stigma, and they wanted to go on another step, and they wanted to go on to another community group that they could see that was struggling with similar stigmatizing issues. And that was a group of untouchables or Dalits. And so the Village Alive project began, whereby the members of the leprosy affected members of the self-help group helped lead a community development project in the Dalit community. And the funding of the project provided funding for clean water, for sanitation, for toilets, for income generation, for child and maternal health benefits, midwifery services, and linkages to local schools, because Dalit children typically wouldn't be attending school. And so that became Village Alive, where you got empowered leprosy affected men and women leading that change in a stigmatized Dalit community. And that's the model that Irish Aid has been funding for the last, I think we're on the third cycle, third or fourth cycle, depending how you count it. So we're just completing one 3-year project, and we're starting another one this autumn. So we're very thankful for Irish Aid for that, because it's a massive help for us to do. So we have 150 self-help groups. We'd like to be able to scale that up to all of these self-help groups, and we do 5 at a time with Village Alive.
Okay, that's great. Thanks for that. So the COVID obviously has been an issue around the globe. So I assume that Nepal Leprosy Trust, the things that you have been doing in the Lalgarh hospital, it must have been affected as well. So how the COVID-19 has affected all overall your work, the work that you have been doing?
And you want to start, or will I?
Well, I suppose COVID has particularly affected Nepal, since there's been that big outbreak of Delta variant in India, and things got very bad for a while there. And the rates are still high, but they have come down a little bit, but they're still pretty high. And there's been over 10,000 deaths in Nepal, and certainly there's been plenty of COVID in the region where the hospital is. Through various, I suppose, associations that we have with the hospital, we were able to fund a supply of PPE at the beginning, but I think they also had PPE donated from other sources as well. But at the beginning of COVID, they had very little by way of personal protective equipment in Lalgarh, and that was a huge risk for the staff. Even when they got some PPE, but nowhere near enough, and so they were basically using it and washing it and reusing it, even though it is just kind of paper, a lot of it. So it wasn't ideal, but they were doing that. But they have been able to protect themselves, and they've also been able to get vaccinated, and they have treated cases of COVID in the hospital at this point in time. But I think they've also continued the leprosy work in as much as they're able during the time. I think during lockdown, people may not have been able to travel for their medication and all that stuff. But I think that overall the work of the hospital has kept going. I think from NLT Ireland's point of view, the main effect has been that we haven't been able to travel to monitor the various projects that we're supposed to be monitoring. So that's been a little bit of a problem. So I don't think we've sent anyone now for almost 2 years. Would that be right, Mike?
Yeah, yeah.
So that's I suppose the other main effect that it's had. And
we should thank the Nepal Iron Society that helped contribute to our COVID appeal in buying PPE and oxygen concentrators.
So very good, yeah.
Yeah, that's kind of is happy to help. Basically, the fund that we have raised is organically donated by the people of Ireland, the generous people of Ireland. We are just an avenue to send the money to various organizations like yourself who are doing great work for the people of Nepal. So thanks for that information, and hopefully this COVID will go away, and so we can go back to our normal life. Let's hope so that that day won't be isn't that far. So another regarding, as you said, so you have quite a few donations that come from the general public. So if somebody new, so who wants to contribute to Nepal Leprosy Trust and the projects that you have been carrying out now and in future, so how do they get involved? Like, is the funding wise, as well as if they want to get involved in person, so basically be part of the project and help out in projects, what do they need to do?
Very good. Well, we have a website, www.nlt.ie, that has quite a lot of information on it. There's a link there for PayPal if anybody wants to make donations. We're quite a small charity and we're quite approachable, and we quite like, or a lot of our donors like to be very closely connected to the particular project that they're supporting, whether it's adopting a child through school or sponsoring, it's quite fine-grained what we can do. So I'd say if you want to reach out to us, drop us an email. There's an email link on the website, or you can just send to info@nlt.ie. Sorry. That's probably the easiest way. Currently, we don't have many public meetings, so but probably near Christmas time, we'll have some craft sales and people can connect, those kind of things, coffee mornings. But it's a bit difficult to connect at the moment. If you're very interested in seeing the work in Nepal, when we're hoping, if the government lifts the restriction, if you like, for travel, unessential travel, we'll probably send a group out before Christmas and probably another one in the second quarter of next year. If anybody wants to travel out with us, visit Laugard Hospital, see the community work, then we're very happy to facilitate that if everybody obviously covers their costs.
Great, that's grand. So if those who are watching here today and those who will be watching us, watching this recorded video later on, if they want to get in touch with Nepal Leprosy Trust, they can email us directly or send us a message on Facebook, and we'll put you to Mike or one of the staff at Nepal Leprosy Trust. So one thing that you bring up there regarding people who are interested to travel to Nepal and see what Nepal Leprosy Trust is doing in Laugard Hospital and different projects that it's carrying out. And maybe another thing I'm just asking means, have you done some sort of volunteering package, things like from Irish students or people here who want to go to Nepal as a volunteer? So do you have any plans for that, or have you done that already?
NLT Nepal would have volunteers mainly at Laugard Hospital on a fairly frequent basis, but your skill set would normally need to match something that's in demand. So it's not unusual for doctors to go out, volunteer for a period of time, or nurses to go out. Other professionals, it's not quite as easy to connect. The benefit, if you're only going for a couple of weeks, the benefit is really to the person who's traveling rather than the organization. So you need to go for a longer period of time. But there would be potential for volunteering if you want to go, definitely. But you'd need to fit some need at Laugard, if you like. Otherwise, they're just looking after the volunteer. Certainly, Anne and myself, we both volunteered with NLT. I was out there 4 years, so if probably at a minimum 3 to 6 months.
The other thing I would say, I mean, I suppose Nepal 25 years ago when we were there, a lot of the work of NLT was kind of dependent on volunteers, but now really the staff are mainly Nepali, and
yes,
they keep the work going. And I think that's, I mean, it's nice for people to go and visit and see the work, but as Mike says, the benefit is generally to the person going rather than the organization. It's run very capably and well by the Nepalis that work on for the organization. I was going to say one other thing. Oh yeah, they do take medical students on placements, which is a very nice thing for a medical student if they can manage to get out there. And that's, I know, but they tend to be from around Europe. So the ones I met last time I was out, they were from Switzerland and stuff. So they it's, again, you'd have to probably book it well ahead. But it's a very nice placement for a medical student.
Yeah, that's great. I think that's good information to have for the students and the medical students here. So I have come across a couple of students in the past. Basically, I helped 2 of them to go to Nepal to do an internship in one of the hospitals in Nepal. So maybe in future, when this current pandemic is over, we could look into providing, like sending medical students to Nepal for volunteering on a regular basis. Yeah, that's great. Thank you. So now you already have been doing great work there. So apart from what you have been doing now, is there any specific plans in the future that you are thinking to do?
I think we're just, the funding of community development requires international donors currently. I think with the new federal structures of Nepal, the funding of services like leprosy services could possibly change. And it would be wonderful if, say, Province 2, the one where Laugard Hospital is located, was able to partner with us in developing the leprosy services. And so I think the long-term trend is away from international aid for providing these kind of services and more to a country like Nepal sustaining its own services for its own people, particularly as income and wealth is increasing in Nepal, maybe at a slower rate than we want. Are you still there, Deepesh?
Can I come in there and just say something?
Yes,
I think oh, he's there. Yeah, I just want to say, I suppose there's a couple of things like Nepal NLT Laugard provides the government leprosy service for Province 2. It's not, they work with the government, and I think more and more they will be working with the government. I think the plan for NLT from a leprosy treatment point of view, the long-term plan can only be that they would do themselves out of a job in terms of, we don't want to be seeing in 20 years' time the same instance of leprosy. And they do, I think that's a feasible plan. And I think so. I think the long-term plan would be that the hospital in Laugard, which is a beautiful hospital on a beautiful site, would become a general hospital, to treat everything, and that leprosy would be a very rare disease in Nepal. That would be the long-term hope. That's what I would say.
That's true. Just to add in there, okay, so if NLT was successful in Province 2 at reducing the incidence rate of leprosy, so you had no new cases, that would be fantastic. But if you are a leprosy patient and you have suffered nerve damage and so on, that's for life. And so NLT will provide care for life for leprosy affected patients in Province 2. But we are hoping that the focus as has happened in Green Pastures and Nandaman Hospital, the other leprosy referral hospitals in Nepal are moving a little bit away from leprosy into other areas. And Laugaj is hoping to develop a specialty in general medicine and skin conditions, that's dermatology. That's the expectation.
Okay, cool. Yeah, so now obviously we want this to be eliminated, like no new cases and everybody cured, there's all clean. So do you see the possibility of this getting eliminated entirely from Nepal and from around the world?
Well, I just answered that. Nepal, leprosy was, was a common disease in all of Europe until the 1900s, the early 1900s, it started to decrease. And really the much and all as the treatment and the case finding and all that is useful. How leprosy would be eliminated in the end is by the elimination of the extreme poverty that breeds it. And so those community projects, building up communities, building up the economy of the area and the country are what are eventually going to be the most effective in eliminating it. Because it is definitely a disease of poverty and of extreme poverty, and that's what's happened in Europe. As the water, sanitation, housing, employment, as all those things increased, leprosy decreased naturally, and that we would expect would also be the case. I mean, the economy of Nepal has definitely improved in the last 20 years and will continue to improve, and that's going to be what will achieve it mainly in the end. And the work that Nepal Leprosy Trust is doing with those really, really extremely poor communities in the Village Alive, with those Dalit communities, that's the real groundwork for the sort of I suppose improvements that are needed to eliminate leprosy. So until poverty the poverty levels are decreased substantially, I don't think leprosy will be eliminated, but I think, not by medical means alone. And I think that when Nepal's economy begins to, really pull forward, I think that's when leprosy will be eliminated. And I think it will be eliminated, yes.
Just to add in, there's no vaccine developed for leprosy.
But having said that, the vaccine for TB, the BCG vaccine, is about 70% effective in reducing leprosy as well. So again, all those things help. But yeah, the elimination of poverty and very poor housing and very poor nutrition and crowding, that will go a long way towards helping.
Yeah, that's great. Thanks for sharing that information. I think we have covered pretty much all important topics today. So as I mentioned at the start, the main idea of this event, this program that we are starting is to talk to different organizations and people who are working in Nepal, who have projects in Nepal, and who are basically in connection with Nepal, and to know about what they have been doing. So, and we wanted to also understand Nepal Leprosy Trust, the work, the great work that you have been doing, and the extreme of the circumstances. And on behalf of Nepal Island Society and all Nepalese community here in Ireland, I would like to thank you for what you have been doing. And we really appreciate the work you have been doing. So before we end, we have Alison and Patrick Ganga here. If you have any questions, you can put it to Mike and Anne.
Yeah, could I just ask something? Just in terms of the actual bacteria itself, I know you've said that it's very much related to poverty and poor conditions and poor nutrition, but where does it harbor itself, or how does it breed? I know it's contagious, obviously, but is there any way other than is it sanitation you need to kind of try and reduce the level of bacteria that's there, or how do you go about doing that?
No, it's not a hygiene thing. It's spread the same way. It's a mycobacterium. It's similar to the bacteria that causes TB, but it's much more slow growing. And where it likes to grow is it likes temperatures slightly below body temperature. So it likes about, I think it was 33, 34 degrees. So it tends to affect the extremities of the body, or parts of the body where nerves are very close to the skin, so they're slightly cooler. So there's a few nerves that it particularly likes. There's one there near your knee, and there's one in your elbow, which are close to the skin surface and tend to be just at a slightly cooler temperature. So it likes nerves and skin that are slightly cooler than 37 degrees. It is, however, that's where it multiplies. But that's how it begins. But when it gets into your body, it can also, the more it multiplies, it then goes into your respiratory tract and into your basically your upper respiratory tract. It starts in the skin of the face and the nerves of the face, and can multiply right into your respiratory tract, and that's how it's spread. Then when somebody who has it in their respiratory tract, same as COVID, coughing, breathing, sneezing, it spreads to the next person. So when you're in an overcrowded situation, and when the person that is at the receiving end of the aerosols or the droplets that are being coughed out is in a poor state of health, especially. So if they're young, or if they're malnourished, they're more prone to getting it. And if they haven't had a BCG, again, they're more prone to getting it. So it's not a hygiene thing. It's not a thing of like, if people kept their houses clean, they wouldn't get leprosy. That is not the case. But if people were better nourished and didn't live in such crowded conditions, they certainly would be less likely to get leprosy.
Okay, thank you. And in terms of you say the BCG is 70% effective. I mean, is there actually a vaccination program in the kind of high leprosy areas, as a matter of course?
There is a childhood vaccination program in Nepal, a government one. Its reach probably wouldn't be quite as good as, say, in a country like Ireland, where we get maybe 90-95% coverage of childhood vaccinations. And then there would, leprosy tends to be a disease of it's most common kind of younger adults, older adults, and not in children, but it can occur in children. But so, say the people that are getting it now in their 20s, 30s, the 20, 25, 30 years ago, the childhood vaccination program would have been pretty non-existent in Nepal. And so those people are still very vulnerable, and most of them won't have had a BCG. I think also you will have, as the health service does improve and has improved, you have increasing levels of children being vaccinated with BCG. So that also should make a difference. But it'll take a while before that kicks in fully.
One of the strands of the Village Alive project is child and maternal health. And so certainly in the villages that we work in, the Dalit women mightn't present at health posts or avail of midwifery services. So they're a bit out of the loop, if you like. And one reason for that is they were stigmatized by those same services. So we work to overcome that. So they're often a bit out of the loop of what should be available,
Yeah.
And they need their confidence building to access those services. And once they get through that process, then they're fine. But currently they can be outside a lot of the services that they need for health and well-being.
Okay, thank you very much.
Thanks, Anne. Mike, do we have any more questions?
Yeah, hang on a second. It's Patrick here.
Hey, Patrick.
Can you hear me?
Yeah.
Yes.
Hello to Limerick. I worked in the Midwest in Surket, Virendra, and we had a leprosy hospital there. I was running a mother and child clinic, and the leprosy hospital was a mission-run service, and I don't know, has that sort of carried on, or have the leprosy hospitals decreased with the number of cases or whatever?
In Surkhet?
Well, generally in Nepal, I mean, I mean, you know, there would have been, in different districts, there would have been leprosy hospitals, I guess.
I think, if you don't mind me saying this, just about virtually all the leprosy services would have been provided by Christian organizations, as nobody would work with leprosy affected patients.
Yes.
They, to my understanding, say, for example, in Nandaban, in Kathmandu, in Green Pastures, in Pokhara, the original agency is still supporting those hospitals, but but because the leprosy caseload is decreasing, they're encouraging them to change the focus of their service. But probably the tendency would be to have less international volunteers or professionals coming in, and for Nepalis to be taking those roles on. So say, for example, in Laugard, we only have one expatriate currently, and he may be retiring soon. You know, so we would be 100% Nepali then at that point, which is really what
you have to also say that he's actually married to a Nepali lady who's a nurse in the hospital. So like he's kind of,
that's true.
He's a Bideshi, he's not quite Bideshi.
But the trend has been to keep getting support from international donors, but move to a model that is more sustainable with Nepali nationals leading the medical work.
But having said that, Patrick, I wouldn't have been aware of a leprosy hospital in the area you're talking about, but there may well be one. It might have been.
I don't know, the Midwest, I mean, this was in the mid-1980s, I suppose, so it was a long time ago, but certainly any children that we suspected, we would refer to the leprosy hospital for diagnosis. And it sort of worked quite well. There was a TB project also run by the same mission group, I think, and again, but they did TB in adults. We did TB in children. But no, thank you both very much. That was very good. Thank you. I enjoyed that.
All right, great. Thank you very much. So we have come to the end of this program. So I think we have covered this before. So if people want to find more information about Nepal Leprosy Trust, I think they need to go to www.nlt.ie. I have put it on our Facebook page as well, so that people can access the website from there. So apart from that, Mike and is there anything you would like to add before we wrap up?
Just thanks very much for the opportunity to talk about the work of NLT.
Yeah, thanks. I'm always, when I think of this kind of thing, when I first went to Nepal, I was 27, and I volunteered in a pottery of NLT, and I remember one of the leprosy affected men thanking me for coming, and he, of course, in Nepal we say namaste to each other, but when we were saying namaste to each other, he grabbed my hands and he put his hands over my hands. And leprosy affected people, they can have lost their fingers and their skin is very dry. It's like sandpaper. But him reaching out to me and clasping his hands around mine showed me how important it is at times that we help each other and we use what we have for the betterment of everybody. And you know, I just wanted to say that really, you know, it's been a fantastic thing in my life, helping in Nepal, and it's a real joy that it's, you know, it's complete. When somebody thanks you like that, you know, you're completely blown away.
That's great. Yeah, it obviously means I've been first-hand witness of the work you have been doing, and the amount of work you have put in the academic sector, publishing so many papers, as well as your struggle and your effort to get funding for Laugard Hospital and the things that you have been doing in Nepal. is really great. And again, I would like to thank on behalf of Nepal Society and all Nepalese community here to you yourself and all your team and everybody at in Nepal, in Lalgarh Hospital, and the team in Nepal, Nepal Leprosy Trust team in Nepal for the work you have been doing. With that, we come to an end of this program, and thank you again. Thanks to all our viewers. So we'll come back next week with our new guest. Thank you all.
Good day.
Thank you.
Thanks, David.
Bye.
Thanks. Bye-bye.